Well, good morning and welcome to yet another one of our thematic ecosystems. This time we're partnering up with colleagues from Spain, Denmark and Italy to look at remote areas and specifically today looking at how sustainable solutions for healthy aging work in remote areas, because long time now I've been working in adult social care nearly 35 years, and getting care in cities is sometimes seen as easier than perhaps in some of the more remote areas. And remote doesn't always necessarily mean rural either. So some of those areas that are harder to reach or harder in terms of connectivity are important. So we've brought together, as part of our convening ability at the ECH Alliance, a group of players under the auspices of the Digital Health Uptake Project, led by one of our Spanish ecosystems, to look at this, because this is particularly acute in many countries. And I've not yet been to a country, perhaps probably with the exception of Singapore, where remote areas are struggling to pick up the sort of services you see in some of the major urban areas. So just for those people who don't know who we are, my name's Andy Breeden. I work for the ECH Alliance. We're the Global Health Connector. We're a member organisation and we bring together over 1,100 members. We'll put up some information for you to find out more about that if you're interested. But I'm keen that you understand that we use that group of members in a network of over 80 different ecosystems, some of which are here today. We've got ecosystems in Spain, Italy and Denmark, but also 80 other locations across the globe, including Australia and Zimbabwe, the whole A to Z of ecosystems. This creates a brilliant, what we see as infrastructure for best practice sharing, as we're going to see today, but also learning from people's failures, and also I see as a great implementation network. So each of these ecosystems, whether it's Carmen in her ecosystem or others, are great for connectivity for people who want to implement programs, solutions, and get their products adopted. So without further ado, I'm going to hand over to Carmen, who's going to host today's ecosystem and introduce you to some of the themes for today, but also introduce the speakers on our program. Carmen, over to you.
Thank you, Andy. I will share my screen. Hello, everybody. Welcome to our webinar. Today, we will be discussing this topic, the sustainable solutions for healthy aging in remote areas. And this webinar is organized by Digital Health Uptake. My name is Carmen Galán de Isla, and I work in Fundesalud as a project technician. But today we have two brilliant speakers to cover this topic related to healthy aging. It's a pleasure to count with the presence of Kim Toft Madsen, the CEO of the Aquatime Enterprise, and Simona Ferrante, that worked as an associate professor in the Politecnico di Milan. Before giving way to our speakers, I would like to show you the agenda of this session. Firstly, I will provide you a short introduction about the foundation where I work. Then each of the speakers will present their projects. And at the end, there will be a roundtable discussion where the speakers will answer the questions from the audience. You can write your questions in the chat. Let's go over the introduction. Fundesalud is a public foundation that belongs to the Regional Ministry of Health and Social Services that in the government of Extremadura. Our foundation manages the research and development that takes place in the healthcare system and in the social care system. And some of you may ask, what is Extremadura? Well, Extremadura is a region of Spain that is not heavily populated, and it is geographically dispersed. I belong to the scientific coordination area. Jonathan Gomez is the scientific coordinator, And we are a multidisciplinary team working on different projects related to active aging, health, technology, or chronic diseases. Here we have some examples of projects we are working on related to this topic, to healthy aging. For instance, we are working on the NOAA project, Never Home Alone, whose objective is to develop a robot for the elderly people that live alone. We have other projects called EuroAge Plus, International Network for Research, Innovation and Technology Transfer for the Promotion of Active Aging, and the project CERT 65 Plus, integrating multisectorial actions to support healthy and resilient aging. Now, Simona will talk about the Essence project. Simona, the floor is yours, and please introduce yourself.
Thank you very much, Carmen. Okay, I'm Simona Ferrante. I'm associate professor at Politecnico di Milano in Italy, and I'm a bioengineer and expert or really keen to develop technology at the service of brave people. And today I'm going to present a European project called Essence that was funded by Horizon 2020 and started in the end of 2020 and last year, in which we were coordinator of the project, and also Funde Salud was one of the partners in the consortium. We had a consortium of 9 partners, 3 technical universities, 3 companies, mainly small and medium enterprises, and 3 clinical end users. And this consortium was mainly already involved in another research and innovation action project before Essence that was a bridge to understand what were the main and the most important modules that can be tested and field tested in rural areas for promoting active aging. In the end, the project aimed at transforming, it was a call responded to a call of COVID, and was aimed at transforming the lesson learned from COVID in a huge opportunity that was aimed at exploiting technologies towards an evolution of the services targeting vulnerable population, in particular non or pre-frail seniors. In this sense, to contribute to the public health response, we would like to boost the creation of an ecosystem, a new model of home-based care. And this ecosystem was aimed to connect, stimulate, monitor elderly people in their homes towards promoting active aging, socialization, and early detection of cognitive decline. If you can see here in this sketch, we were thinking that the preferred environment of the elders is for sure their own home, but we want to offer them a way to socialize and to connect each other through cognitive and social gains. In this specifically, we built sort of virtual rooms that were rooms in which they were playing together while they are seeing each other and they were interacting socially with each other. Then we were offering also physical stimulation with gymnastic practice at home, and we were offering few modules to monitor their health. In particular, we were developing and we patented a smart ink pen, and we were monitoring and driving without asking them to do anything particular, but just using the pen as a normal pen to understand if their gesture was changing in time. Or we were monitoring their voice through calls with their peers, for instance. And the system was able to understand if something was changing in time, and in case of need, there were the possibility to activate a sort of teleconsultation, a first contact to the relevant other, in order to activate at the point of need and help. So just to understand better the ecosystem, we have this use case that can give a better idea. Let's imagine to have George, aged 74, that is living at home, and due to COVID in that period, this was the main problem of socialization, let's say, and becoming a problem for health for sure. He was not able anymore to do elderly associations or to stay with grandchildren. So we were, with Essence, providing an ecosystem that is engaging him to be in contact with others, playing games. This was the main menu of our system, or do gymnastic according to his preferences. So it was not a program, it could be also a preference of the user. So without any imposition. We were monitoring his situation, and when an alert is detected, we are activating an help. So it is a complete digitalization of a service at home. We were able in the project to co-design the solution with stakeholders, and after for sure an iterative testing in the lab, we were doing a pilot testing in protected environment. Here you can see Servimayor, that is a structure of protected environment in Extremadura, in which people, elders, are living independently in their apartment, and there we were able to do the first test with seniors. We involved about 10 seniors and clinicians to better refine our solution, that then was undergoing a longitudinal field testing in Extremadura, in 6 different municipalities in Extremadura that, as Carmen mentioned, were a little bit dispersed, but we connected about 56 seniors. Here you can see that mainly they were women in reality, and clinicians, and they used the solution for 8 months, so for a long period. And just to summarize the results we got, we had the opportunity to understand that the compliance was very good. We were not expecting this because, as I was saying, we were allowing a free use of the system, at least at the beginning, and all of the seniors used the system more than 2 hours per week. And this means that they were engaged in using a lot the system of socialization. They were connecting a lot together, playing together, and they created new networks. In the beginning, we thought that there was a connection around each municipalities. Instead, they were really knowing each other in different places. And there was also this constant possibility, because it was funded by a European project, and there was partner called to do this, that they were training a lot the user in the use of technology. This helped a lot because we were creating also moments in which they were meeting together in groups to understand how to play together, and then going home, they were translating in their own use of the technology. But this helped a lot in the compliance in the end. Additionally to this, we reached also a good prediction with a good accuracy, even if there was any imposition of doing like writing exactly the same sentence every day or things like that. They were using a pen as a standard pen, taking notes, and we were understanding if something was changing in time. The only challenges, I mean, the main challenges that we had is that we got a system usability that was at the threshold. So it was around 70. That is, that means that they required support of a technical person. So we were, as I said, training a lot to the use of the technology, and have in mind that they had multiple models to use all together. So this increased the difficulty that they got at the very beginning, but then they accepted to use the system. Indeed, the good engagement that we got was also confirmed by the fact that most of all, the user, 91% of the user, kept using tablets and the pen and their smartphone soon after the end of the project. And this was for us a great success. The main success was to see that all these people were really collaborative with each other and wanted really to share their experiences. So it was really great chance to work in remote area, because I think that in this area there is a sense of collaboration per se that somehow simplify a little bit the interaction with user, and this is what I learned the most because it was one of the first time I was working in rural areas. Indeed, I live in Milano, as you may have noticed. That is completely different environment. So these are the main results we got. For sure, I'm more than happy to answer to your question and curiosities. And these are the contacts that you may use to connect with me. Thank you very much.
Thank you very much, Simone. It was a great experience for us to participate in the ESM project, as you know. And now Kim will present the Alpha Time project. Kim, the floor is yours, and please introduce yourself.
Yes, my name is Kim Toft Madsen. I am the CEO and founder of Aquatime, where we have developed this intelligent drinking glass for preventing dehydration. So we started back in 2018 to develop this solution in close collaboration with a Danish municipality.
1 second, Kim.
Yeah, yeah.
We can't see your screen.
Oh. Sorry about that.
No, it's okay. Thank you.
Sorry about that. Yes, once again, we started the development of this solution for preventing dehydration back in 2018 in very close collaboration with a Danish municipality called Albertslund, just outside Copenhagen. And the main reason for this development was a tender issued by the municipality because they were out looking for a solution to prevent dehydration. And nowhere, not in Denmark or nowhere else in the world, they found. So then they decided to find someone to develop the solution from zero. So during the next 2.5 years, we worked very closely with the municipality. It included 15 elderly people and the whole home care sector in the municipality, meaning the care staff, the health staff, and the management. So you can say the solution was really customized to the needs, both for the elderly, but also with the focus on making the daily work easier for the staff, for the care staff. And the way the solution works is we measure very exactly how much the elderly are drinking. Furthermore, we are able to recognize a drinking movement compared to pouring out. So if they pour the water out in the sink, it will not be calculated into the daily liquid intake. It's an IoT solution, meaning it very easily connects automatically to the network. So you don't need either Wi-Fi or Bluetooth. You simply turn it on and then it connects, and then it sends data from the device into our web application. And from the web application, we also have the possibility to integrate the data into the public systems that the care industry are using. Furthermore, to stimulate the elderly to drink more, we have developed a nudging functionality, meaning that the device stimulates the elderly to drink more based on the target you have set for the elderly of how much they should be drinking and within what time slots. Then the device monitor throughout the day how much have the elderly been drinking. And if they don't drink, the device starts to play a tune or give some other kind of noises that makes the elderly look at the device and then start drinking. It's a very user-friendly solution, meaning that there's no buttons, nothing on the device. It's simply a glass that the elderly can drink from, and it can contain both cold and hot liquids. Furthermore, it has a display indicating how much you have been drinking so far during the day. So both the elderly themselves and the staff can see and follow without looking into any kind of systems how much has been drunk so far. So by having this solution, first of all, we know how much the elderly are drinking. We are able to get them to drink more. And in the same time, we are now able to provide the carers with exactly numbers of how much liquid intake the elderly really have done. So they themselves are able to give them the right kind of medical help. And furthermore, they are also, of course, able to stimulate the elderly and force them to drink even more. In March, we finalized a huge project together with the second largest municipality here in Denmark called Aarhus. They had, during a 1-year period, had a clinical project looking into what kind of value are aquatime really giving to the municipalities, both for the elderly people and also for the staff. And the results were really impressive because, again, it showed that 63 of the elderly people that had joined this project had an increased functional capacity during this period of time. Meaning that if you have an increased functional capacity, first of all, of course, the elderly having a better life. And furthermore, they demand less care. So it was both beneficial for the elderly, and secondly, of course, saving quite a lot of time, meaning money, for the care sector. They were using a standard called functional independence measurement. It's an Australian way to measure on what category the elderly are having their functionality capacity. And that measurement, by using this measurement, they could categorize the elderly where they were before using aquatime and after a period of time. And then they could see this quite dramatically increase. Furthermore, they also looked into the quality of life of the elderly. And here they used the HO5 well-being score index. In the same way, they tested the elderly participating in the project before giving them an aquatime solution. And then after a period of time, they did the same test again, and there was a quite big increase in the well-being. So also here we had a fantastic result. Finally, but not least, they were of course also looking into how much time did they save by using aquatime compared to this manual fluid balance chart process that they were using today. And the result in this project was a time saving of 30% compared to the way they were handling it before. And they estimate themselves that this will increase, because this was the first period, by using and there was a lot of training and so on for the staff. So we expect that the time savings to be even higher in the future in the municipality. So you can say on all parameters, we succeeded in this project to really prove that the solution gives a better life for the elderly. They needed less care, and the staff spent less time on this fluid balance charge process. And then another benefit by looking at the fluid balance charts, the quality of data was really increased compared to the manual process. Because one of the very sad thing about the manual process is you really don't know if the elderly have been drinking the liquid from the device or a glass, or they have poured it out into the sink. But we can see that by using aquatime. I give you here one example from the project. This was an elderly guy called Preben. He was 85 years old. And he had a lot of cognitive challenges. His memory was more or less lost completely. He was very passive. He was not able to even tie his shoelaces. So he needed quite a lot of care. And in fact, the relatives thought that he might be suffering for a kind of depression or even dementia. But then he was included in this aquatime project. And after a few weeks, in fact, just after 2 weeks, the daughter called and she was a grown-up daughter, called the municipality in Aarhus and said, "Thank you, I have got my father back." But because suddenly he was able to recognize the name of his grandchild. He was not remembered her name for more than 2 years. For 2 years. He was now able to, he was active. He talked during lunch and dinner. He was able again to put on his shoes by himself. He began drawing, and it was a fantastic story. It's like a flower that hadn't had any water for a period of time, and suddenly it get water and it blossoms, and everyone was happy, and then he was active again. So for me and for the whole project, this was just one of many very interesting cases where the elderly really got an improved life just by getting more liquids. That was what I was expecting to tell you right now, and I would also gladly respond to any question you might have.
Thank you, Kim, for your clear explanation of the project. I was very happy to see this positive result with the elderly and this experience. Thank you very much.
Yeah, and I might add that during the development process, we also were in Extremadura and had a very
Yes.
good collaboration with Fonda Salud as a spin-off of the project, of the development project, to secure that this solution was not just working in Denmark, but also in Europe. And right now we are expanding our or increasing our market. So we are now in 11 countries all over Europe, and were acquired by a huge Danish corporation called Abena last summer. So now we are expanding our solution into the world.
Yes, we hope that many seniors could benefit from the
I'm sure they
academia
will.
soon.
I'm sure.
It's okay. Now we have the roundtable discussion. The participants can write the questions in the chat. Yes, we have one question. I can read it from one of the participants. How are fluid restriction managed? For example, to avoid those with heart failure drinking too much and becoming unwell due to much fluid.
Yes, we do have quite a lot of people with liquid restrictions where we try to prevent them to drink too much. And an easy way to do that is just to introduce the device for the users, because they themselves can see on the display how much they have been drinking so far today. Furthermore, we have the possibility to include alarms, the same as a kind of the nudging functionality, meaning that if you reach a special level, it could give a sound on the device saying, now you have been drinking more than enough. But in fact, in the same project, as I just told you about in Aarhus, we had in fact someone with liquid restrictions, and they really had that strange challenge that they were afraid of drinking too much. So they were almost dehydrated because they had been told you must not be drinking more than maybe 2 liters. So due to that, they were so afraid that they drank less than 1 liter. But by having the AquaTime device, they can look on the display and see by themselves, okay, now I have reached 1.8, 1.9 liters. Now I should stop drinking today. So first of all, the quality of life was increased dramatically for these people. And furthermore, of course, the physical increase were also easy to measure.
Okay, thank you, Kim. Thank you from our participant. There is another question. What for the two speakers? I'm opening the window. What are the barriers to adoption in your countries?
If I should say it, my answer is, first of all, when you introduce this kind of solution, it's a requirement that the management of the care sector is involved. That's even though you have a very simple product, it's very important that the management, and you have to have a kind of change management process involving how should the daily process be after implementing welfare technology solution. And furthermore, also look into the roles and responsibilities for the ones taking care of the welfare technology products. So you can say the technology itself, there's no problem nowadays. The market is quite mature. So now the most important thing is to implement it in the organization. And I'm not talking about the technical, but the more organizational implementation. You can say that the funny thing is the elderly nowadays, especially maybe here in the Nordic countries, but I guess we can see, and it's all over Europe right now, they are very interesting in using welfare technology products. So there's a kind of funny things happening right now that the elderly are more or less demanding and expecting welfare technology products, but we have to convince the carers, and of course not just convince, but also show them that this will really help them in taking care of the elderly. And of course, as we all see all over Europe, we are getting a huge lack of employees in the care sector. We are getting more and more elderly people. So we really need to include welfare technology product and also relatives in the future care.
Yeah,
Thank you.
totally. I totally agree. This is the first point, very important. I think that other barriers are also that the most of these, let's say, products can be are products for prevention or for maintaining healthy aging. So are in a step of the healthcare in which the management is not having big budgets to spend, or as not already reimbursement procedures that assist the elders, not only in having it and using it, but also in managing the sense of having it. And in this, I mean that they are keen to participate. This is completely true. I totally agree with that. But then they need to see the value, to be supported in their environment that includes, for instance, their doctors that should be in touch with that. They should be not a B2B market, but not a B2C market, but a B2B market, in which that layer of assistance, of support, is a layer that should not be provided because there is a European project that is paying for that and you have there the possibility to do that, but should be in the management of these devices. Because only with this layer, you can build the trust in a system that should become the routine, and not an additional thing that it's a game for a period because they are keen to participate. For instance, I think that a link shouldn't be not only with health management, but also for social services. I mean, I was extremely in touch with the so-called Casa Mayores in Extremadura. Now also in Italy, we have a lot of these facilities for elders. But this link in using device, supporting for this, is still missing, in my opinion. So I completely agree with your view, but I think that we need to change the model of supporting this device and be sure that the devices are reliable, because it's true that with technology we are everywhere, but reliability is something different. So it should be very carefully selected, in my opinion.
Right. I agree completely, absolutely. And this is not just the care sector; it's the whole society that has to look into how to utilize welfare technology relatives. You have to look into, okay, where are the money spent nowadays? Maybe the hospitals are in fact the ones who will have a better economy because we are preventing dehydration, but the cost lies in the care sector. So we have to take the overall picture and see what can we do, but because again, we have to do something. Otherwise, it's a catastrophe because again, the increase in the elderly, as I spoke about yesterday, previously, is something we just have to do something about.
Thank you. It's true that we have to see this kind of solution as a whole and to implement in all the different parts of the society to be success and to have it integrated. I have a question for Simona. We noticed a big gender imbalance in the field testing of the Essence project. How can you explain this? Is it possible to somehow personalize the digital solutions to consider it?
Yeah, it's true. I mean, as I was mentioning, among the 60 users, 53, something like that, were women. So we got a great imbalance in gender. And in the very beginning, we were not expecting this at all, because if you're looking at literature, you can see easily that men are more keen to use technology than women normally, and women can feel more anxious in not understanding how to manage the smartphone or whatever. But in the end, we did also a huge questionnaire among elders in 3 countries, spread in 3 countries during the project, among 500 elders, and we got that indeed women were more keen to use technology for leisures. And this is what they perceived in essence, I think, because these big socialization virtual rooms were very, very used, stellar compliance with that, playing things while speaking with others, while knowing others. And this is something that is more, at least we were testing it in Spain mainly. We should understand if it is cross countries also this habit, but in Italy was exactly the same. I think that the personalization means that you may offer different modalities and you may personalize the things that you are using to socialize. For instance, the few men were more keen to play cards together than doing, let's say, other games like words games or things like that. Apart from them, the perception of having something that monitors you was a bit scaring more the men instead of women. This is what I perceive, and it would be curious to see if it is the same perception also for drinking water, for instance, that it's another thing that maybe is more mediated by a need than in essence. But in any case, I think that personalization and building the solution with the target user should be the way of understanding better what they really need, because they need to change their behavior. They have to produce a behavioral change, and not only, as I said before, a period of time of use that doesn't mean anything in the end in their life. In the end, in essence, we were not really personalizing a lot because we were more leaving them free to choose what their preference. So we were not working a lot on this. But in principle, I think that personalization is for sure something that we could get, and making also adaptable to what is happening is another way that can be somehow explored. I don't know if I answered the question.
Yes, of course. Thank you very much, Simona. I have a question for Kim. You mentioned that the hydration among the elderly is a significant and growing challenge. Do you have any indications of the actual scale of this problem?
Yeah, there's been quite a lot of surveys during the last couple of years in Europe. And it looks like that, and that's quite frightening figures, that approximately 40% of the elderly at nursing homes are suffering from dehydration. And if we look into the home care sector, the number is a little bit more than 20%. And the way we know these figures is nowadays when the elderly are hospitalized, it is some of the thing they are looking at when, even though they maybe have just broken an arm, they are investigating, are they dehydrated or not. So these are in fact evidence data from the markets. So that is huge numbers.
Yes.
And of course it might differ from yeah.
Thank you very much, Kim. I have other question for both of you. Are you involved in the development of new devices for healthy aging? If yes, can you tell us more about it?
I mean, if I can start, what we are more involved now is development of a smart ink pen that was already started during Essence and tested. Now we are in the procedure of certifying it in order to put it in the market. But before doing this, we are collecting a lot of data on not only on let's say healthy aging elders, but also on pathologies, because in this case handwriting is a biomarker of also a problem in different pathologies. And we are trying to focus our attention in understanding if this device that is very easy to use, because it's just a pen to write on paper, can be exploited as a screening device, early detecting early sign of decline. Handwriting is a fine gesture that requires a lot of cognitive and physical fine activities. So it's something that if there is something arising, it's visible on this, and it's also a tool that is very, very used by geriatrician neuropsychologists, but also in the care. So with this instrument, we are able to provide the instrument at home, provide the instrument in clinics, but also using it while controlling and telemotor. For instance, in Essence, we were including the pen in the teleconsultation. So during the visit, they could run tests with the pen, and the consultant, I mean the clinician, was controlling the pen in the houses of the user. So it opens a lot of different uses, and it doesn't require a lot of, in this case, assistance in the use. It's true that they can easily, it's a pen, okay, so they can easily let's say lose it, but it's also used that the value is not the pen itself, but it's what is behind the pen. So all the software, all the algorithms that we are researching on to assure reliability in order to detect the first sign. So in this, we are in collaboration with a lot of also clinical centers to prove the clinical reliability of such data. So we are boosting on this at the moment, hoping that we can find a way in the future. Thank you.
Yeah, and of course we do a lot of development right now. We got a lot of you can say requests and wishes and from the market regarding future capabilities for our solution, and also for areas that is not within liquid intake, but again welfare technology products. So we are right now developing quite a lot of different kind of solution to improve quality of life for the elderly. But if you look into our own area, just saying that now we are also focusing on having a solution for private person, not just people in the care sector, but for private elderly people. And hospitals are quite interested in our product as well. So you can say we increased the market very, very dramatically during the next year to have improved solution for a broader range of elderly people.
Thank you.
You can say, just to add a few things, we look also into that now we have more and more data, which makes it possible for us to use AI in the future, maybe to be even better to prevent dehydration, because as it is today, you can say more than 90% of the users of aquatime are suffering of dehydration. So we would be happy to try to catch them before getting dehydrated.
Thank you very much, Simona and team. It sounds very interesting for the next future. I will share my screen again We have prepared some questions for the participants. I invite the panelists and the speakers to participate too, using this website that is available on the slide. And you have to enter this code that appears on the screen. Once you have prepared, my colleague Elizabeth will share her screen. There is the first question. In your view, could digitization improve the quality of life of elderly people in remote and rural areas? We can see that all the participants say yes. They trust in the digitization for improving the quality of life of the elderly people. Do you have any knowledge of whether or not these initiatives are currently running in your country? The answers are divided into the two options. Some people doesn't know if this kind of initiatives are running in their countries, maybe in the future. And let's see the last question. Please describe in one word the overall conclusion you have drawn from this presentation. Great. Interesting, encouraging. Gorgeous. Digitalization. Yeah, I think that's maybe one more word. I think that the website is updating. No? Okay. I think that we can close. Finally, I want to say thank you to the speakers and to the audience for their participation in the session today. I think that these initiatives will help the elderly people. I believe that can have a great impact on the elderly people to age in a healthier way. I don't know if Simone or Andy want to provide a conclusion for our webinar.
I think it's been really helpful. So thanks for all our speakers. And I think it's another example of where we need to stop reinventing the wheel and see that things are being implemented elsewhere successfully, whether that's in Denmark or in Italy. So that's the idea behind these ecosystems. And the more we can do that, the quicker we'll get these adopted, as opposed to having to come up with country-specific solutions all the time. So thanks for those, and thanks for you, Carmen, for bringing all this together.